bring you a live debate between Brad Ashford and Kara Eastman.
Good evening and welcome to tonight's debate, the race for Congress in the 2nd Congressional District. I'm Michael Severe with the Omaha World-Herald.
And I'm Craig Negrelli with KMTV 3 News Now. We will be your moderators this evening. The primary is 3 weeks away, and tonight for a half hour, we will have a robust exchange of ideas between the two Democratic candidates hoping to challenge Republican Don Bacon in November.
Democrat Brad Ashford is the former Omaha congressman as well as former state senator. Democrat Kara Eastman is the president of Omaha Healthy Kids Alliance and the member of the Metro Community College Board.
We will give equal time to each candidate. We're asking you to keep your answers to about 60 seconds. And when we ask you to move on, please do so. In addition, we reserve the right to follow up. We also want to give the candidates a chance to respond if they are directly criticized. So, without further ado, let's get started, and Michael has the first question.
Mr. Ashford, you have advocated for more gun control. In the wake of the Parkland shooting, we've seen protests from both high school students and others who agree with you. Why are you the best person to tap into the new enthusiasm for gun control?
Well, first of all, thanks to KMTV and the World-Herald for this debate. This is great stuff. I started working on the issue back in 1988, 1989 when we passed, actually in 1991, our permit to purchase law. At that time we tried an assault weapon ban. It didn't go anywhere, but we continued to work on the gun issue, gun reform issue throughout my legislative career. We created the Office of Violence Prevention, and I advocate universal background checks. I think the assault weapon ban, which I felt possibly would never happen, I think the students have changed the dynamic. We've gone from no, no, no to yes, and I think we're at yes on the assault weapon ban. And if such a bill came to the Congress, I'd vote for it, even though I thought it was out of the question 2-3 years ago.
Ms. Eastman, same question to you. What do you think you can do to get this enthusiasm for gun control?
Well, I would support an assault weapon ban, and actually I would be proud to introduce that because it's a shame to me right now that our students are being braver than our policymakers when it comes to this issue. We need common sense gun safety regulation, and we need it immediately. We're seeing shootings happening in Omaha in the last week. This is unbelievable that we continue to let this happen. I too support background checks, as do the majority of Americans. I support mandatory waiting periods, and we need a ban on weapons of war and the sales of weapons of war.
Ms. Eastman, would you be willing to compromise on a border wall to get certainty for DACA recipients? And if so, what would you want to see as part of that deal?
Well, I don't support the border wall because we don't need it. It's not the right solution, and it's actually not something that we can afford. But right now, more than ever, it's time for us to protect our DACA students. I've been talking to DACA recipients in the district who are terrified. They're terrified that at any minute they are going to get deported for no reason, and they were brought here through no fault of their own. We need to pass a Clean Dream Act because it's time to stop using these DACA students as political playing cards, and politicians need to stand up for what's right.
Mr. Ashford, 60 seconds on DACA and the border wall.
Carr's absolutely right. We do need to stand up for the DACA students. And I believe that the DACA students should also have a pathway to citizenship. I also believe that their parents should have a pathway to citizenship as well. I supported the 2013 Senate bill that never got a vote in the House that would have created a pathway to citizenship. I think it's the right policy. These people have been constructive parts of our society. They've added to our society, and they do so every day. And Kara's right. They were brought here without any fault of their own, and it's absolutely past time. And this is another issue where we should go from no to yes. We should pass the pathway to citizenship, and certainly we need a clean DACA bill.
Mr. Ashford, the next question is just for you. No rebut on here. You've been for and against the Keystone XL pipeline and for against an assault weapons ban. Why should voters trust you that you'll do what you say you're going to do in Congress?
Every time I've passed a piece of legislation or introduced a bill, I've never introduced a major piece of legislation in my 18 years as a legislator without going back to the community first. Most of the ideas that have for example, the Veterans Hospital bill, whatever it is, emanated from my community. I don't just put bills in, and we've had good success. So I think the voters can certainly trust me because I have done what I said I was going to do for 18 years. And as far as the pipeline bill, I thought, did the right thing in the legislature when we passed a bill that addressed the environmental concerns. I did introduce an assault weapon ban. I support an assault weapon ban now. You know, if you don't change your mind on things once in a while, you're just plain stupid. You can never change the world if you don't change your mind. So once in a while, over the 18-year period of time, times have changed, issues change, they're dynamic, and I've tried to change with them. But I've always gone back to my community before I introduce legislation.
Ms. Eastman, direct question for you, no rebuttal from Mr. Ashford on this one. You have never held elected office at the city, county, or state level. What makes you believe you can go from the Metropolitan Community College Board straight to the federal level?
Well, I have spent my entire over 20-year career in public and social service, and for the last 12 years, I have been actually working in and for the community. I've raised over $13 million to invest in safe and healthy housing for our children. I've developed public-private partnerships. I have worked with the HUD, EPA, CDC. I've actually brought those federal dollars to Omaha, sometimes to Nebraska for the first time. And actually in 2011, I worked with Republican Senator Mike Johans to create the Healthy Housing Council Act. I've done things in Congress without actually being in Congress. So I say put me in and I'll show you what I can do.
All right, it's time for the candidates to ask each other a question. And through a drawing of cards in advance, Mr. Ashford, you go first.
Well, Carl, let me ask you this. Okay. You have advocated for a single-payer plan for health insurance, and I respect that. What would happen if you were in Congress and the single-payer bill didn't even come to the floor, but realizing that we needed to do something on health care, what would you do?
Single-payer healthcare, or providing healthcare to everybody, is actually gaining a lot of traction within some of the up-and-coming leaders in the Democratic Party. We're seeing a lot of support, and it's something that, in the 40,000 doors that we've knocked, it's the #1 thing that people talk about is healthcare and their right to healthcare. There are bills right now in the Senate, like the Consumer Health Insurance Protection Act, that actually would move towards single-payer. But making sure that more people have coverage, making sure that premiums are lowered. That bill would ensure that nobody's paying more than 8.5% of their income towards their premiums. We have to take hold of this issue. There are too many people going bankrupt and having to choose between paying for their medical bills and putting food on their table, and it's immoral.
All right, Ms. Eastman, it's your turn to ask Mr. Ashford a question.
In talking to the voters in the district, people say that the reason that you lost your seat in Congress in 2016 was because you voted against the Iran nuclear deal, against the Clean Power Plan, against DACA, for the Keystone Pipeline. How do we as Democrats know that you're not going to turn your back on us?
Well, first of all, we can go through every one of those issues if you want to. I voted against the Iran deal for the same reasons that the Iran deal is being called into question today. JCPOA does need to be amended. I did support JCPOA after it came into effect and supported the continuation of JCPOA. I think what were the other things that as far as assault weapon ban, I'm fine with the assault weapon ban now because of the students. I think they can, they've changed the game. As far as the Clean Power Rule, I didn't support it because I don't like the way it's drafted. It would have been dangerous for OPPD because it would have interfered with the progress they were making. I do support the Paris Climate Agreement. I think it was disastrous that we pulled out of it. I think there are other options to the Clean Power Bill that I would advocate. More subsidies for wind and more subsidies for solar and other alternative energy sources. But I take each issue as they come. I'm not bound by, I've tried not to be bound by partisan politics, and I try to take an independent position. But most particularly, I fall back on my constituents to give me the kind of input that I need to have before I cast a vote.
Okay, continuing along. The Omaha World-Herald asked readers to submit questions. Mr. Ashford, this question is from voter Camille Hawbaker. She said this: I work in the university system, and wages for adjunct faculty have not kept pace with cost of living. And I watch with alarm as students struggle to make ends meet. It takes a toll on the education system. What solutions can you offer to make higher education more affordable here tonight?
First of all, adjunct faculty members ought to get credit on their student loans for being adjunct faculty members. I also would like to see that public service exemption, the ability for people who go into public service, that be expanded to people who have other employment but work in public service as volunteers. They ought to get credit on their student loans. There ought to be a 3% cap on student loan interest. There ought to be a situation where employers can now deduct the $5,000 a year they help employees with their student loans, but it's taxable to the student. That ought to be changed so that it's not taxable to the student, and we ought to raise that amount up beyond $5,000 to $7,500 a year.
The reader that wrote this in, would you like to say anything to her directly? I mean,
well,
she's obviously very concerned.
She should be concerned. Adjunct faculty, first of all, don't make enough money, and it's unfortunate there are cuts to the university this year. That was not a federal issue, but clearly, but I don't see any reason why adjunct faculty members don't get credit on their student loans.
All right, Ms. Eastman, here's your chance. Same thing, higher education.
Well, it's a really important question, and in particular for me being a board member at Metro, I hear this from adjunct professors all the time. Student loan debt in this country is crippling our young people. It's a threat to our national security, and we have to do something about it. And this is something where we need action now. I do support the College for All Act, and I believe that we have the ability in this country, and we've done it in other states. We've actually piloted free two-year college, community college. Places like Metro are innovating in such an amazing way by partnering with local businesses, by making sure that we're getting people out of poverty and into education, high quality, affordable education, and into jobs. This is something we need for policymakers to take a hold of, because we have to understand what our students are going through.
Anything you'd like to say to the reader directly who sent this question in?
Well, I appreciate the question, again, because I hear this all the time from people as a board member of Metro, and I would like you to know that I understand this issue. It's something that's near and dear to my heart, and I will fight to make students, to put students in a position where they can have debt-free tuition so that the United States can be as strong as it needs to be.
We stay with you, Ms. Eastman. What kind of leadership do you want to see for the House Democrats, and would you vote for Nancy Pelosi as the leader of your caucus?
Well, one of the reasons I'm running is because I think we need new leadership. We need different kinds of leaders within the party, within both parties. And obviously, we're okay with having political outsiders join and get into the ring right now. But we need people who can also make sane, sound decisions for the country, and people who are going to fight. We have far too many people struggling. We see this in the district all the time in my work at Omaha Healthy Kids Alliance. I'm tired of watching people struggle to make ends meet. I'm tired of seeing people living in unsafe, unhealthy houses. These are things where we can take the people who have been working in the community like me, social workers like me, political outsiders, and actually start to develop leaders within the party. There are a lot of up-and-coming leaders within the Democratic Party, and I can't wait to get into Congress to pick that leader.
Well, in terms of that, Ms. Pelosi, would you vote for her?
I would like to reserve my time to wait until I get into Congress, because I think I need more information to make that decision, but I'm excited to have that opportunity.
Same question to you, Mr. Ashford. What would you do in terms of the leadership for the House Democrats, and would you vote for Nancy Pelosi?
Well, first of all, we need to get to 218 members in the House, because we're not seeing change with the current Republican majority. The Republicans have control of the House, the Senate, and the executive branch, and literally zero is getting done on the issues Kara is talking about, which are very key issues, on the issue of student debt, on the issue of immigration, on the issues of health care. Zero is getting done because the center of the Republican Party will not work with Democrats. We need to get a Democrat majority. You know, in all my 18 years of being a legislator, I've never prejudged who I would vote for Speaker. I might vote for Nancy Pelosi, I might vote for somebody else, but I'll make that judgment when the time comes. But we do need competent, stable leadership, and we need a Speaker who will take the temperature of the body, and for example, we shouldn't be going into issues until we get the budget done. We haven't had a budget for years, and we need to have a speaker who's committed to getting a budget on time so that we know what's out there to spend, what we're authorized to spend, and so that we can address the needs that we're talking about in this debate.
Let me ask you this, Mr. Ashford. How badly did the Pelosi issue hurt you, if at all, in the 2016 race against Don Bacon?
Well, Kara said there's lots of things that hurt me in 2016. We lost. So, I am who I am, and I'm going to try to be as independent as I possibly can be, and I think that's what the district wants. But I don't think it did. I think that there were things, there were headwinds in the 2016 election. We won in 2014. I'm proud of my time there. I don't think, I'll tell you one thing, I would hate to be somebody that had supported Paul Ryan, who put in place the largest deficit in years, it's going to take years and years to pay off, and the debt's going up. So he's not a conservative, and so I'm sure the Republicans feel, my goodness, how did we get him as speaker? So I would never vote for anybody that would make do those kinds of things. But I don't know. I mean, I think it was a close election. It was 1%. I feel confident we can get the seat back. I think the wins are behind us, behind the Democrats generally, as Kara says. And I feel very confident we're going to get the seat back.
Okay, moving along to the next topic, and Mr. Ashford, you're up. We touched on this a bit earlier. The Affordable Care Act was intended to make sure every American has access to health insurance. But rising premiums make it difficult for many Nebraskans. What specifically could you do in the next 2 years of Congress to address health care costs?
First of all, we need to pass the Alexander Murray bill, which shores up the ACA for now, so that we can continue to cover, so insurance companies will continue to participate in ACA. I support the ability of every American to have as much choice as possible to bring the cost of, which will help bring the cost of insurance down. I don't think we're going to be able to politically move 150 million people off of their employer health care into a single-payer government policy. It's very, very expensive. It's at least $2 trillion a year, maybe even more than $2 trillion a year, with tax extenders over 10 years or taxes going up at a rate of about 18 trillion. So I favor letting Americans buy into Medicare. It's a structure that already exists. There are 3 bills right now in the House that would allow all Americans to buy into Medicare on the ACA. And I think that's something that would work, give them the choice to buy into an existing structure that exists already in the healthcare field.
All right, Ms. Eastman, on healthcare costs and the Affordable Care Law.
Well, one of the problems in Nebraska was that we didn't expand Medicaid, which means we left billions of dollars on the table, and we also left people without health insurance. I'm running for Congress because my mother had such outrageous prescription drug costs, and that was with Medicare. She was paying $800 a month for her drugs, and her doctor wanted to prescribe her a pill that was $2,500. Imagine $2,500 for a pill. That is crazy. Most people in this country cannot afford it. My mother wasn't able to afford it, and it meant that she wasn't able to leave the house until she passed away 7 months ago. I believe healthcare is a right, and I will fight to make sure that everyone in this country has healthcare. We are the only country of our size, of our wealth, of our stature that doesn't provide healthcare to everybody. And it is time to put a stop to this. People are dying, people are suffering, and we need our policymakers to fight for them.
Ms. Eastman, this next question is for you. Can you name any areas where you think you can work with congressional Republicans or President Donald Trump?
There are a lot of areas where I think we could work together. I mean, I think on healthcare is a good start. I do believe that most people think that healthcare is a right. Now, we might have different ways of going about it, but my work in Omaha has centered around bringing people together, people with different values, people from different backgrounds, and people with different political affiliations, bringing them together to find solutions to problems. When my nonprofit was started, Omaha Healthy Kids Alliance, the majority of our board was appointed members of from the Nebraska delegation. That meant they're mostly Republicans. Well, lead poisoning and unhealthy housing does not discriminate based on your political party. So I intend to work with Republicans, with my new colleagues, and with the president on a number of things. But we need people who are going to stand up for the people of this district. And right now we have a Republican in office. We don't need another one. We need an actual Democrat, and that's what people are excited about right now.
Mr. Ashford, same question to you, working with the Congressional Republicans or with Donald Trump?
I think I'm an actual Democrat, Kara. I'm proud of being a Democrat, and the voters put me in there in 2014 when there were no other Democrats running. So I'm proud of that. But and I'm proud of the fact that so many of my colleagues in the House are supporting me, and the Democratic caucus wanting me back. I feel I'm very proud of that, and I'm very proud of representing Nebraska in the House with the support of the Democratic caucus. But I think there are three things we could do right away. One is immigration. I don't think there's any question that there are moderate Republicans, I know who they are, I can almost name them, who would vote for certainly for DACA, but if the leadership would give them a clean bill. On health care, no question in my mind that we could, first of all, the Murray-Alexander bill would pass in a split second. On health care, for sure, and I think we could also encourage Republicans to vote for a Medicare option, and then I think the Republicans would support making the tax bill permanent for the middle class, the tax cuts permanent. That was a big mistake in the tax bill. The whole tax bill was a mistake, but not making the middle class tax cut permanent, I think, was a significant, and I think Republicans would support that.
Let me ask you this, Ms. Eastman, about President Trump. Could you work with the president as a Democrat?
Absolutely, I can work with anybody, and I have a proven track record of doing that. I think that saying that I'm the only lifelong Democrat in the race doesn't necessarily mean that I'm tied to a party, but it does mean that I'm tied to my principles, and I'm somebody who's going to stand up for the values of the people in the district, and knocking 40,000 doors gives you a pretty good idea of what people are looking for in their representative. And it seems pretty clear that they're looking for somebody who's going to stand up and fight for them, and that person is me.
All right, we've reached the point in this debate where we have to take a short break. When we come back, the candidates and their closing statements.